So this storm brought light and fluffy snow, but it dumped a lot of that snow. So that means shoveling, snow blowing, and doing it over and over again. Through it all, you have to look out for your body's warning signs.
So joining us right now is Dr. Jorge Paleski, the Director of Preventive Cardiology at Brigham and Women's Hospital. Great to have you, Doctor. And it's an important and timely subject. Question one. Digging out is an awful lot of work, whether the snow is fluffy like it is now or watery. What exactly makes it dangerous for some people?
Well, for a lot of people, it might be the first time they're really exerting themselves, and shoveling snow, moving snow is quite an exertion. You can very quickly get up to your maximal heart rate by moving around snow, especially when it's heavy, but any kind of snow. And the fact is that exerting yourself with your arms is a greater workload than necessarily just working your legs. The cold itself can be a factor. It can cause constriction of the blood vessels, and that can also aggravate things through the cold air, going to your lungs and contributing to that. And so, that's the challenge that snow can pose, whether it's a lot of snow and if it's, heavy, wet snow in particular, it can be a problem.
Doctor, it's so good to see you. Happy New Year. If people look up your bio, they'll know that you're the best of the best. I had to say that because you're answering our questions, and I want them to know that. Is there anything people can do before they shovel to lower their risk?
Yeah, well, as cardiologists and preventive cardiologists, you can do something, long before that first snowfall by staying active and eating right and talking to your doctor and having your cholesterol under control, your blood pressure under control. But, right before you're going to shovel, a case can be made for, loosening up and stretching. It is a form of exercise. You can, cover your mouth as a way, with a scarf as a way of heating air on its way in, and then importantly, pausing and not feeling like you have to push all the way through it, but listen to your body. If you're not feeling right when you're doing it, sometimes it's better just to stop, especially if you have a history of heart problems or have high risk for problems, or even if you're just older. Those can all be reasons to say, you know what, I think I'm going to leave this to a kid in the neighborhood or a professional. But pausing, taking your time, not lifting and sweeping, not trying to move the snow with your arms. Those can all be approaches that can help decrease the workload.
So let's talk the extreme. What is the point that you call 911? You know what I mean? You've done those things and suddenly you're not feeling well. Should you just sit down, or do you respond to it immediately?
Well, any persistent symptoms that don't resolve with your stopping and resting, those would be times where we get concerned. It's not always that classic, chest pain and elephant sitting on the chest, radiating down the arm, causing nausea, causing shortness of breath. Sometimes it's more subtle, like an ache in the jaw, or for some people just, getting winded and feeling winded even though you stopped and have rested. So if those symptoms persist beyond, 5 to 10 minutes, then you have to start thinking about maybe I should get some help. You want to, stop exerting yourself, get into a warm area if you can, and then, get help. We much prefer to see someone and decide that it was nothing than to have someone get into trouble who was hesitant about asking for help.
I didn't even think about stretching before shoveling.
That's a good reminder. Yeah.
It is.
Yeah. And the other good reminder is, listen, how many storms we get? Maybe 8. So, you can hire a professional to do it too. All right, Doctor, thank you so much.
Great to see you, Doctor.
Yeah. Great to see you.
You look wonderful. Stay well.